Hi everyone, welcome to week 1 of our recordings. I do apologise, I'm a bit sick, so you might not be able to hear me, that's why I've got these in today. So week 1 we did primary survey and rapid trauma survey. My name's Casey, I live 2 hours from Canberra on a rural farm. I live by myself, manage the farm and work full-time in Canberra as well as doing this. So for week 1, we went over the trauma survey and how it's different to a normal survey. Starting with our scene sizer. Let's have my book over here. So we went over how we do a windscreen survey, seeing what's going on, how we're going to approach the situation, what equipment we'll need, how we should relay back to headquarters, letting them know what's going on, how many, and what's actually going on at the scene. We also went over scene safety, the same PPE, hazards, where we park, all those sorts of things, what equipment we'll need for the job. A thing that we did go over that I found new was in the primary survey, the CACBCDE, so just adding the extra C at the beginning and in the middle. So usually you start with airways, breathing, circulation, but in the trauma survey we go catastrophic hemorrhage, which would need to be addressed first to then see if we need to do anything else. Then go the airways, and the C spine is the second C, which I found interesting, which definitely makes sense for trauma because that can definitely help. Going on from there, we do the secondaries of vitals, history taking, all those sorts of things. We also went over, which I found interesting, is where you take the patients to, knowing that if you're in a metropolitan area, you try and go within 60 minutes of where you are to the nearest hospital to try and get the best possible outcome for your patient, or if you're in rural, it needs to be 90 minutes to go to actual trauma centre as opposed to just a everyday ED, because EDs around the country around here definitely don't cater for what we'll need. We also went over how you'll need to call for backup early for certain trauma situations, so identify what's needed and getting that done first. I've run a bit over time, but that's definitely what we did in our first lectures. So yeah, stay tuned for week 2.